Tippendales, it's Saturday, and we don't release episodes on Saturdays except once a month when we release our interview with the guest tipper of the month. And our guest tipper for May is none other than Joel Ciolek, physician assistant in ophthalmology, a dear friend of mine, and a joy to have on the pod. You are going to love the tips you're getting from Joel this month. Joel, welcome. Would you please give a brief, fast rundown of who you are, what you like, and what you do during your time on this rock spinning through space without reckless abandon?
Well, first off, thank you for having me, Ned. And yes, more than happy to. So everyone, I'm Joel. I am a PA in ophthalmology. I'm based out of the West Coast in Seattle, Washington, having spent some time in California. I really value relationships and connecting with people. I'm very relationship oriented. I tend to do better more in an intimate one-on-one setting than a large group. I enjoy depth and vulnerability. If I know that's available, then it helps me be more whimsical and just carefree and funny because I know if I need that type of relationship that it is there and available. So as I get older, I kind of lean into those types of relationships. Outside of work and connecting with people, I enjoy concerts, sporting events, exercise, swimming laps, reading, listening to music, and singing with my friend Ned in the kitchen when we're just cooking away.
Joel is a dear friend, but Joel is also one of the kindest and smartest people I know in some of the widest breadth of knowledge, and I really am excited to get him in here to chat with you. First things first, when I was making sure that I got your profession correct, I said, you're a physician's assistant in ophthalmology, and you said, hold on, people will come after you for that possessive, and now I need to understand. Could you please tell me the difference between a physician's assistant and a physician assistant?
Yes, so I won't come at you. That's just not my personality and whatever, but some PAs will come at you because the possessive implies that you basically assist the doctor. So think you're a medical assistant and you're helping that doctor room their patients and kind of do what you're told by them. So the physician's assistant just implies you're their assistant, secretary, whatever you want to call it, but people assume to. Whereas physician assistant, that is the title of our name, although they just changed it to physician associate, which I also can't get used to, but it implies more an independent provider. It's not possessive. In other words, I am not the doctor's assistant. Patients can see me. They can see me on their schedule, but I'm also not a physician, and I am totally okay with not being a physician, and I don't want to be called a physician. I tell my patients at the end of the day, just call me Joel. I'd rather be relatable than formal.
I'm a Joel is a very funny way of describing what you do. Joel, talk to me about ophthalmology. What in your life brought you to eyes?
So I've always had this imagination of medicine ever since I was a kid. But it was just moral imagination because I never actually did it. It was rooted in moral things, helping people, wanting to impact people's lives and do good and give back. But it truly was imaginary because I never actually did it. And I chose to become a PA because they invite you to do medicine before you commit your life to studying it. In other words, to go to PA school, you have to have patient care experience. You have to have experience in the healthcare field before you can even apply. And I liked that. I felt that was a gift. And so I was able to get experience in ophthalmology. And I went into this clinic. I shadowed a family friend who was an optometrist, the only one I knew any sort of adjacency to medicine. And I started shadowing, and they offered me a job on the spot. And then I became an assistant to the providers there, and I was thrusted in this world. And I just fell in love with ophthalmology because I think it's where the emotional side of medicine and the physical side of medicine overlap. Eyes are very inviting. They're emotional organs. We communicate with them. And so for me, I found I just get to spend my day looking into someone's eyes for a living. And I thought how beautiful, how unique, and all the differences that we see externally, whether it's race, religion, sexual orientation, you name it, they go away with eye contact. And it's just a human. And I got to see their heart behind it. And I just really fell in love with the pathology, that there are physical things that occur in your body and the eye is telling that. And then there are obviously primary ocular diagnoses, but I'm constantly diagnosing systemic conditions in the eye. And so I've really enjoyed its connection. And then lastly, I just felt patients were more active in their care, to be honest with you. Medicine's hard, especially in a society where not everyone in this country has access to healthcare, obviously, but the majority do. And we don't really know what it's like to live in a world where you don't have access to healthcare. And because of that, I think we take it for granted every now and then. And you spend time talking to patients about their health, and they don't care to get better because they know they can just go get help when they need it. And again, this is not everyone. I've worked with many underserved patient populations in this country, and I do know they exist. Sorry, the lighting's changing on me. It's like middle. But where I'm going with this is that I found with ophthalmology, patients were more active in their care because you can't ignore eye symptoms and they actually want your help. And so instead of just talking to what felt like a wall in training, trying to teach someone about their hypertension, their high blood pressure, their diabetes, and they have no desire to actually change and get better. In ophthalmology, patients actually came to you and they really wanted your help because they use their vision, they use their eyes. And that to me is someone I wanted to partner with. I wanted to work with a patient who actually wanted to do their end of the work and not me do it for them. So for those few reasons, I'm drawn to the field. It's also rewarding. I mean, you can turn someone from blindness to vision in minutes with surgery. I mean, how cool is that? It doesn't get old.
So I am a human in this country who takes advantage of my healthcare, but how can I come to you the best version of being a patient? Like what is the mindset I should start adding to my medical journey to be a better patient, to have better outcomes in this way that you are talking about?
I love that.
Not just in ophthalmology, but also in other medical fields as well.
In general. Come with an understanding, like here's a little behind the scenes. There's a healthcare system in our country that forces me to see a lot of amount of patients in a given day. And if I'm running behind, it is not because I'm late to work. It is not because I, on my lunch break, went to the gym and I didn't come back for an hour after I was supposed to. It is usually I'm behind because the previous patient needed to open up about something that they wasn't on their chief complaint. Their appointment is booked for something and there's actually something else going on. And it is very hard to sometimes emotionally separate when you're in one room and you're with a patient who is actively suicidal and having then to go to the next room and the first thing you're met with is you're late here. You're late. You're running behind. I need to reschedule. And it's 10 minutes past their appointment time. And you just want to be like, man, if you only know, but you're not allowed to because it's HIPAA, right? So you take it. And I wish patients had a little more perspective over their appointment time. And I understand we all have places to be and I work my hardest to be in on the room on time. But I wish they knew that usually if the provider is behind, it's out of their control as well. Secondly, I wish patients would bring in a graph of their medical history. Do you know when you make like a family tree and you list off like dad and mom and like cousins? Well, do that for your medical history and within your family and bring it to your appointment. Instead of me having to be like, so do you have a family history of glaucoma, macular degeneration? And people are like, what? I love it when a patient hands me a piece of paper and I'm like, fantastic, because I can just see it all and I can document it all down because genetics play a large role.
Okay, so then here's the thing that I know about you, Joel. I really didn't know much about your work for like a very long time. What I knew about you was outdoorsiness and a love of adventure and a love of travel and constantly kind of jet setting places real quickly on as cheap a dime as you could manage just to go see something. So I want to pivot a little bit and say, like, when did wanderlust hit you? Is it a lifelong pursuit of travel or is it something you found later?
I would say, as long as I can remember, I've always had this innate curiosity for other culture. Like since I was 5 would be my earliest memory of just what else is out there. So there is that aspect that it's always been there. But that's changed as I travel more. It used to be so focused on destination, go to this city, I want to see the city. Now it's for relationship. I don't really pick where I'm going because of the destination. It's how we met, right? Do you want to come to Yosemite National Park? And my friends that are from New York City are in town? Sure, because then I get to hang out with these people. Do you want to come to my wedding in Bali? Yeah, I didn't choose to go to Bali. I chose because of these friends and everyone going there. do you want to go to your wife's birthday in Puerto Rico? Yeah, I'm not going to Puerto Rico. I'm going to spend time with these people. So that is really where my wanderlust has changed in the last 3 years. I choose it off of relationship. For example, this year, my friend Abby, one of my best friends, is a sailor. She's a flight nurse, ICU nurse, and she sails all over the world. And she invited me to go sailing in the Seychelles. I've sailed twice. My first thing was like, you realize I'll be dead weight, right? Like, I can't do the night shift. I have no clue what I'm doing all this. But she's like, yeah, it doesn't matter. I'm like, okay, I'll go. It doesn't even matter where we're going or what we're doing. I'm going because I want to spend time with my friend. And we get to go do in the Seychelles.
That's pretty cool. Do you have any tips and tricks for like last minute trips or trips on a dime, like on a budget? Like, how have you been able to like go on more trips because of you know, deals or just like intelligent planning?
There's two that pop to mind. This one I felt more comfortable with as I traveled more. And it's a little easier when you solo travel because I've done a lot of that. Usually now I just book my hotel the day I get there. I have booked a hotel when I got from Bali. I went to Japan. One of the most expensive things in Japan is housing. I didn't book my hotel till I was in the line to enter the country, the security line. And the woman checking me said, I need to know what address you're going to. And I was like, I don't have one yet. She's like, well, where are you staying? I'm like, oh, I haven't bought it yet. So in line, I bought a hotel and it was 75% cheaper because I bought it 2 hours before I checked in, right? They're looking for last minute deal. So if you're okay with that and flexible, that works. This isn't so much of a cost saving adjustment, but if you feel comfortable in saying this, every time I get to the gate for my flight, I always go up to the gate attendant and I say, hi, I'm just wanting to let the flight crew team know that I am efficient in CPR. So if there's an emergency, they can just come straight to me. Like if I'm asleep, why are you asking on the overhead? Is anyone here available to assist? That makes no sense to me. Like, especially if it is a true emergency, like we should know. And I feel like we should just kind of have people on the plane that are already like notified, like go to them. So I usually just let the gate attendant know, like, hey, can you give the heads up that I'm seat 23A or whatever it is, that they can come to me. And they're usually like, oh my gosh, thank you for helping. And they're like, hey, like, are you interested in an upgrade? I've gotten upgraded so many times to first class or business because I just show I'm willing to help. So that's a little bit of a perk as far as if you're looking to save some money in a seat, but you also have to feel comfortable doing that.
You have to be a medical professional and medically trained. I probably can't do that with my wilderness first responder certificate.
Pay big money. Yeah. Put him on the pit, baby.
My woofer is not going to get it done. Okay. You said, you love travel, you love concerts, you love sporting events. So I would love to just like quickly say, like, what is it about the concert experience that really calls to you? You see more concerts than anybody I know. Tippendales, there might be a tip on how Joel pulls that off a little later in the month. But in the meantime, Joel, like, what is it about the concert experience that calls to you?
It's the community. I'm so relationship centric. I have many memories of just I've gone to concerts by myself or with friends, but many by myself. And I'm just standing around and these people who are strangers, you all have something in common. I've met people all over the world from a concert and I still stay in touch with them to this day. The people you're in the queue with, waiting to be allowed in, you're spending all day waiting for the show to start. You're just spending the day together. Basically, at the end of the day, you support each other in line. And now I have friends literally all over the world from this. And it's really cool how music just brings people together. And it makes me pretty emotional that, across different languages and cultures, you already have something in common. And it's through music.
Do you go to concerts for bands you already love? Are you a person who like grabs a ticket to a band you don't really know? Like, where do you fall on the like picking your music experience?
Usually, obviously, priority, it would be someone I know, but am I down to go and check someone out? Yeah, absolutely. I just did that 2 weeks ago on a Monday. It was just like, hey, do you want to go? Invited my coworker. We went and I literally walked in. I was like, I'm so glad I'm here. It was incredible. It was amazing.
What was it?
It was Conan Gray. Not know if you're a fan of him or know him. It was just fun to see everyone be in the culture of it all and experience it. Yeah, I think artistry is amazing. And when someone is actually writing their own lyrics and singing their own lyrics, that means a lot more than someone just over performing someone else's work.
So then looking at the live sports experience, which like live, really it just sounds like you're a live event guy for the community and things like that. But would you say it's a similar grab for sports, or is there something about the sporting experience that separately calls to you? Tippendales, so that you know, Joel Ciolek got a last-minute ticket to the dang Super Bowl. He is a wizard.
I did. I did that, and then my flight was, 2 hours before I left? I'm a Seahawks fan. I'm from Seattle. So, with sports, there is a little bit of a difference, though, right? With an artist, I don't know them on a personal level. I don't follow their day-to-day. With sports, it's this short period of time. There's a season. You commit to that season. You take a break. And you get to follow them closely in that season. So there's this element of, yes, there's this community factor. But when I'm watching, I just really care about this game, and I don't want to be distracted. So it's interesting, right? At a concert, that we're performing, you're all hugging, you're singing together, you're looking at each other. At a game, I'm like, let's not really talk right now. Like, let's watch the game. You know what I mean? Like, I'm really just into the game because I care about the outcome. Whereas the concert, there's not really an outcome. They perform, they sing and stuff. You already know it's going to be a good time. Sport, there's this risk. What if they lose? And that's where then being with people and all that can offset that a little bit. But yeah, it's amazing when they win. And I really love being really indulging into the game for sure.
How do you follow along with your favorite sports events or teams? Like, what is your tip for like tracking through a season?
I wouldn't say I have a tip other than I just go to the games when they're ever at home. And you pre-game beforehand with friends. You go to the game with friends. If you win, you don't celebrate. It's a whole day. It's not just event, leave. Those people where they pull up in the parking garage, they leave before the game's over and they just go home. I'm like, what? Yes. Like, I think college sports is so good at this. You tailgate. And I'm like, bring that back to professional sports, whether that's at a bar, whatever it is, pregame. Yeah.
I'm gonna pivot back a little to travel, but not really, because really I'm now talking about the totality of the experiences we've just talked about. You, Joel Ciolek, have a natural aptitude for the Instagram reel about an experience or about a trip that I don't really know. I make media for a living, and I don't think I can recreate what you do at all. How did you get into this space? How did you learn the tips and tricks that allowed you to do this well? Tippendales, go check out his Instagram. It's in the show notes and watch some of these. You're going to lose your mind.
That's interesting you say that, Ned, because truly that is not something I would say about myself. So it's your perception of me, and whether that's true or not, perception is reality. So thank you. I'm learning how to receive a compliment still. So thank you. There's a learning curve. One, if you go back and look at the first ones, it's like, well, what was he doing, right? So there's a bit of a learning curve. Secondly, to be honest with you, I've always viewed social media as this, and this is also coming from someone where it's not my income source, right? I'm not an influencer, so I don't have to curate in a specific way that's required by maybe a contract agreement. It's strictly just my visual diary. That is where I log my diary. Some of you may relate to this. I love to think back on memories. I just go back and watch my highlights, and I have them tagged by year, and I just see, what did I do that year? It's just my digital journal. I'm a visual learner, and I'm as much as I'm in medicine, I'm left brain, I'm very strong right brain. And so I enjoy taking pictures. I enjoy video. I enjoy piecing together. It's a hobby for me. It's fun. So I don't find social media as this place of, I'm just trying to show all the positive side of me. It's truly just where I want to show so I can go back and look on the memory. But as far as piecing it together and how I did that, just generically speaking, you can use an app to edit. Obviously, a lot of people use CapCut, or even within Instagram, you can do that too. Usually clips need to be no more than 1 to 2 seconds long, slowing the speed down of the clip from like when you record on your phone, going down to say 0.8 seconds for the speed is a lot better visually speaking for an artist. The other tip I would say is never move in the same direction of video. So you'll see a lot of reels that, like, say you're filming and going left to right, and every clip is just left to right over and over. And I'm getting dizzy because I feel like I'm going in a circle, just this. And so you want to piece it where it's more one way. So as their eyes are tracking the video, they're now going back this way.
Wow, that's a secret ophthalmology tip, just to be clear. You just gave an eyes tip buried in the Instagram tip, and I feel like that rips. One last thing for you before I let you go. The last piece of you that I know is you are one of the few and far between physician assistants in ophthalmology, and
it's
you
true.
have sort of a coaching career and a consulting career, talking to other practices who might be interested in adding a PA to their business, or people who are learning to be a PA, things like that. I would love to know just a brief about that, but also, do you have any tips or tricks for people who are looking to add a consulting or coaching side to their career, getting that up and running?
And so just to answer your actual question, honestly, what it finally clicked in me is, and I don't know why it took so long to realize this, but all of us are just our individual brand. And I don't mean that in a shallow sense. You are really representing yourself at the end of the day. And whatever you're in, that's an expertise. You can offer that. And I just happen to be in a field where there's just not many of PAs in ophthalmology. So I really realized real quick, I'm following my passion, but my passion is rare. I was told 200 times no before I got my first yes to actually do this. And that's not an exaggeration. Now I get an offer once a week because I realize I can just market myself. I have a unique skill set. No one else is doing this. Can I show that? So really do some introspective work and figure out, what do you have to offer that no one else can, and market and consult that.
I love that. To close this out, Joel Ciolek, thank you for being our guest tipper of May here on Daily Tips That May or May Not Help You. For the people, could you just remind them where they might be able to find you and follow you and check in and say hi, that they are Tippendale and they now are your friend?
Yeah, and actually, you'd say that you truly would be my friend, because I'm very much like, hey, how's it going? So it's Instagram is the only social media I have, and it's my name, Joel_PA.C.
Well, Joel, thank you for being here on Daily Tips That May or May Not Help You. Tippendales, to give you a sneak peek, we have a tip already on blue light glasses. We have a tip on deeper connections, a tip on how to get good concert tickets last minute, and then a tip on how to reframe experiences. It is a diverse list here this month with Joel Ciolek. And Joel, I'm just so grateful you took the time to spend it with us. Tippendales, please be sure to tune in every Wednesday for Joel's tips, and be sure to swing through Instagram and tell him that the Tippendales say, "What up?"
Thank you, Ned, for having me.
A true joy, my friend.